Epilepsy is a brain disorder that results in seizures.
A seizure is caused by a sudden increase in irregular electrical signals in the brain and disruption or misproportion of neurotransmitters.
Seizures can result in changing emotions, involuntary bodily movements, and changes in behavior. Additionally, loss of consciousness, loss of bodily control, confusion, and others shown on screen.
3 main forms of epilepsy are genetic, structural, and metabolic. Genetic epilepsy is passed down to an individual when they inherit a gene that brings higher chances for seizures.
Structural epilepsy is a distinct abnormal structure in one region of the brain that is either congenital or acquired.
Metabolic epilepsy is an underactivity or blockage of enzymes which leads to an improper breakdown of substances and insufficient energy to sustain bodily functions.
There are 4 major classes of epileptic seizures: focal, generalized, combined focal and generalized, and unknown. Focal seizures affect one part of the brain but can move locations and start with discomfort in areas before becoming a full-fledged seizure. It can be both motor and non-motor.
Generalized seizures affect both sides of the brain, usually first appearing in children, and can also be both motor and non-motor.
Combined focal and generalized seizures are a combination of generalized and focal seizures, sharing symptoms across the two.
Lastly, unknown. Unknown seizures are pretty self-explanatory. They aren't able to be classified due to their confusing and non-consistent symptoms.
While epilepsy is certainly hard to live with, there are various measures one can take to reduce and inhibit the effects of epilepsy.
One of the most common types of treatment for epilepsy is the use of AEDs. AEDs, or anti-epileptic drugs, are pills that, once ingested, change the amount of certain chemicals in one's brain that lower the risk of epileptic seizures.
Another type of treatment some undergo is surgery that removes a small part of the brain that is causing the seizures. 2 more procedures people receive are VNS, vagus nerve stimulation, and DBS, deep brain stimulation.
Both implant pacers, small electrical devices inside the body. In VNS, the pacer's wire is attached to the vagus nerve in the neck, while in DBS, the wires are attached to the brain.
One can also change their diet to achieve the same results from using AEDs. By undergoing a specific diet called the ketogenic diet, chemical levels in the brain can change, possibly resulting in less seizures.
Lastly, if an individual knows what triggers their epileptic seizures, they can stay away from these triggers altogether and avoid seizures. Here are some common triggers for those with epilepsy. If an individual knows what triggers their epileptic seizures, they don't necessarily need treatment if they avoid them.